Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below.
God, I shouldn't have, and it flared up my spinal stenosis.
How did you hurt it?
Doing, I think, kettlebell swings. I wasn't doing them correctly.
When did you do that?
Friday.
Friday, today is when? Thursday.
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 So 6 days ago.
6 days, okay. So since that happened, what kind of symptoms? What's difficult for you to do?
The symptoms have gotten worse,
Okay.
and it's hard for me to lift my arm
Okay.
or sleep, and it's hard to hold anything in my hand.
How much pain from 0 to 10?
8.
8. Where do you feel it?
All right through here,
Uh-huh.
and all the way down my arm, and then down here.
What kind of pain? Is it sharp, dull, aching,
Very sharp and
Mhm.
tingling.
tingling? Okay.
Very sharp.
So for the last 6 days, did you have any treatment?
No.
No? Okay. So I want you to do the range of motion. We're going to do for you the range of motion and let me know how much pain from 0 to
Okay.
10. Okay? So we're going to do flexion. Go up.
Yeah, ow.
How much?
Right there's like a 7.
7. Okay. And let's do abduction to the side like this.
I can't do it.
So it's almost 90 degrees here. I'm going to take the range of motion. Okay. Can you do this?
Ow.
So that's increase your pain.
Yeah.
Sorry. What about going back? Backward.
It hurts right through here.
That's like 7 out of 10 here.
Yeah.
Did you feel anything here?
Right here.
Okay. Right there. So we'll have you lie on your back and I'll take your range of motion.
Okay.
And then we'll do the treatment.
Okay.
Oh, sorry. Okay. So let's actually thumb up and bring it up and stop when you feel pain.
Right there.
Okay. So that's flexion and so here you go. And that is 115. You see that? 115. Okay. Lift your head up. Relax. Abduction. Remember these numbers, okay? I'm talking to you. Okay. Sorry.
Okay.
So this one, can you see this? 125. Okay. Relax. So abduction 125 and flexion 115. We're gonna do external rotation from the side. Relax. Here. Okay. So let's go backward. So this is external rotation. Sorry. Okay. How about now?
That's good.
Sorry. Okay. Relax. So this was 48.
Wow.
Wow, look at this. Oh, wow.
I know, right?
Wow.
I can do that. Wow. It feels
Look
a
at
lot better.
that. Wow. Any pain or it's gone?
No, it's gone. Wow.
Any tingling, numbness?
No, not at all.
Wow. Let's do it again, actually. That's nice.
I haven't
That's
been able to do that in
beautiful.
days.
Wow, that's nice.
Oh my God, it feels so much better.
Let me take your range of motion again.
Okay.
Because we took it like lying down. It's actually, you look like you have a normal range of motion, but I
Yeah.
just want to get... So your question was like, do you want to have MRI or not?
Yeah. No, I think I'm good.
I think you answered the question. I'm not going to answer it.
No more of those. Not enough.
Mm-hmm. So the flexion was 115. That's going up. So let's straight up and okay. That was 115. Now is it's good. We're just gonna need to work on it a little bit. It's 160. Okay. Abduction was 125. That's normal. That's 180. 180.
Wow.
So 180 and elbow. Bring it back because that was very painful. Oh,
Like that, you said?
yeah. Are you trying to show off now?
Yeah.
This is 90 degrees.
No, I'm good.
Yeah. You were like you almost in tears last time.
I was almost in tears when I walked in.
Yeah. So I want to get this 20 degrees range of motion there. Okay. So let's see if we can get it now. Relax. So your range of motion back to normal.
Good.
Flexion.
Wow.
External rotation. I'm sorry. Abduction and external rotation. That's back to normal. The flexion, you are 160. Normal is 180.
Okay.
So we want to get this to 180.
Oh, that feels good.
Sorry. Okay.
No, it feels
All
good.
right. That feel
Good.
okay. Make sure that's not too much. Okay. There you go. Okay.
Oh, that
Let's
felt good.
try the flexion again. Okay, that was 160. Now is 170. Still have 10 degrees.
It's getting there.
Getting there. Yeah, relax. Because this is the area I did not work on. Okay?
No.
Let me just try to release it. Okay.
Oh, that feels good.
Push my hand. Squeeze it here.
Oh,
Yeah,
that's so good.
so you feel this knot here?
Yeah.
Relax. There you go. So we need 270 more. Okay.
Oh, that feels so good.
Feel this one here?
Oh.
So, here we go.
It's like the biggest sign of relief.
Now you feel this big knot here. That's
Yeah.
right in there. Here you go. Okay, there you go.
No more Tylenol.
There you go. There you go. And you
Oh, I felt that one.
you feel the release?
Oh, I felt that
Yeah.
big time.
Yeah. That was like really like
That was the weirdest feeling.
yeah. Okay. All right. It's
Once again, you're a miracle worker.
and well, it's 180.
Once
Back to
again,
normal.
my
Let's sit
miracle
up.
worker.
Let's sit up and do the range of motion again.
Wow.
Okay.
Oh my God, you're a miracle worker.
It's just beautiful. Look at that. That's nice. Okay. Bring it back the other way. Good. Let's do flexion again and abduction this way. All right. So what do you think about ASTR treatment? I know I asked you this before.
The best.
Mm-hmm.
You gave me my
Awesome.
life back.
Yeah. Thank
I
you.
will always be a patient for maintenance.
Yeah.
Or when I do stupid things like this. Thank you, Dr. Jacobs.
Thank you so much.
You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.